Welcome back and thank you for staying with us. Nigeria, like many other countries across the world, wasn't spared from the spread of the coronavirus pandemic. To overcome this challenge, countries have been advised to keep testing, treating, and isolating to reduce infections. Many governments have started reopening their borders. Some opened and had to reshut. But following the relaxation of measures and border restrictions, there are fears of increase in the number of infections. Nigeria's international borders reopened on September the 5th. And this came months after international and land borders were shut down in March to reduce the spread of the COVID-19. So what is Nigeria's status at the moment? To look at this with us, it's my pleasure to welcome both of whom are joining us from Abuja, Yahaya Disu, who is head, Risk Communication Division, Nigeria Center for Disease Control. Good morning. As well as Professor Alashle Abimiku, Executive Director, Institute of Human Virology. Good morning.
Good morning. Thanks for having me.
Thank you for joining us this morning. Now, let me start from my own little perspective. It seems to me that Nigerians believe that the wind that's carrying the virus has blown away. I don't see a lot of people wearing masks anymore. The hand-washing thing doesn't seem to be going on like it used to, and the sanitizer thing as well doesn't seem to be going on like it used to. Prof, do you get that distinct feeling as well?
Absolutely. One tends to get that feeling, especially when you travel across to the rural areas. And that's not unusual. Usually when a population is faced with a new challenge, everybody, fear of the unknown, you do exactly what you're told. And then as you kind of get a handle on it and you begin to understand the steps that you take, then there's complacency. Then in addition to that, you find a virus that it's certainly within the African continent has not been as devastating as the rest of the world. One wouldn't have said that about Ebola, right? Because the devastation is right there in front of you. And it doesn't matter whether it's just one or two people infected, just the way the virus just completely busts your organs, blood flowing, people dying. It's not a joke. But we are finding a number of individuals that are surviving COVID infection and living well. So as we begin to know how to handle it, and as we begin to see people who have had it and overcome it, that complacency comes in. But we as a country really cannot let our guard down, especially as you begin to see second waves and even third waves in other countries. But I must say Africa has been really fortunate, but we cannot stop really promoting all of these measures that have saved us or that has kind of limited the spread in our continent. We've got to continue to do that. It's a hard thing to do because we don't see the devastation, but we really do not have any choice.
Disu, altogether, I think we haven't had more than 65,000 cases in Nigeria. And that number seems small compared to the figures we hear from other countries. And what do you think is responsible for this? Is it that we're not testing enough?
At the beginning of the pandemic, there were a lot of people that were saying that about Africa, including people like me as well, that we're not testing enough and, we're just seeing the tip of the iceberg. But we've really had, about 8 months at least, at minimum, to deal with this virus. We know within the country, Nigeria, from about 3 to 4 or 5 laboratories that were testing earlier, and now we have over 50 laboratories that are tested. All of the states have the capability. So we know for a fact that there is a lot more testing going on. We also know that one thing is to test. Yes, testing allows you to see what is in your population, but the other indicator is also the number of people that are coming in sick, right, at the isolation wards and at the hospitals. Even that has increased. And more recently, the University of Maryland, Baltimore, in collaboration with the government of Nigeria and the Centers for Disease Control in Nigeria, did a population-based survey, seroprevalence survey, to see if we go into the population and test a group of individuals rather than wait for those that are sick to come to us, what do we see generally? And the data is supporting the limited amount of spread that the country is experiencing. So I know that certainly our testing capability have increased, but to a certain extent, I think what we're seeing is real because even in the cases, we're not seeing as many as you see in the rest of the world.
Prof,
If you remember,
Prof, thank you.
President.
Okay, Prof, thank you so much. Even though that question was actually directed to Mr. Disu, but Mr. Disu, we'd like to hear from you in a moment. We'll just take a few seconds and join our colleague who's at the panel of inquiry here in Lagos, looking at the police brutality and other issues that have happened in the last one with Victoria Ido. Just to give us an update, what's the situation at the panel today?
Thank you, Nyota. Presently, it's still a very, cool morning. Not so much is happening yet. It's a few minutes to 11. We're told that the panel will sit at 11. So far, about 33 petitions have been received by the panel, and today on its own, we're going to have 4 petitions that will be heard today. So far, about 2 or 3 of those petitioners are already in the panel, waiting for the panel to start the sitting. The hall is a bit scanty compared to the previous days. Towards my left-hand side, the secretariats are doing their final checks and final work for the day's job. We're waiting for the panel to come in a few minutes. We expect that in about 10 minutes. That's the situation from the Lagos Court of Arbitration. Thank you, Nyota.
Thank you very much, Victoria. We would stay in touch with you and keep updating our viewers as regards the situation at the Lagos State Panel of Inquiry. They are this panel sitting across the country looking at issues around police brutality and the protests that happened in the course of the previous weeks. Well, let's come back into the studio, the Sunrise studio, and continue this conversation. Mr. Disu, the question that Lera asked had to do with how much of testing, Nigeria has a little below 65,000 confirmed cases, and many of them discharged, over 1,000 deaths. That she was asking if the number, as small as it is, can be tied to the fact that we're not testing enough. Yes, Prof has talked about the fact that we need to do more, ramp up the testing capabilities, and NCDC has told us that the testing capabilities have been ramped up and they're still continuously being ramped up. The question is, why are numbers this small? Is that the fact, or because we're not having the people coming for testing?
Thank you for that question. The reality is we still have the cases around the country, and then the number we're reporting may be below the reality. And the reason is what the Prof has just said. We are not testing enough. And to test enough requires 3 factors. 1, the availability of the facilities. Then 2, and the people who show the symptoms and that may be COVID-19 itself or other diseases. And then 3, there should be that awareness and the need for people to come out to do the test. So, but the facilities are available now, We have them in all the states in the country, over 100 laboratories in our network doing the testing. At the same time, we are creating awareness at the state level. The states have really done a lot. In addition to the laboratories, they've created sample collection sites in almost all the LGAs and in some of the states. And then some states are responding, some states are still preparing. And there are resources deployed by Presidential Task Force and also by NCDC to support the response at the state level. And the state themselves are complementing this. So all we need to do is to continue to tell them. But what is more important is to create awareness about it so that those who show symptoms, because what we're doing is we're using a targeted approach. We're not just screening or testing just everybody, but those who show symptoms or who are contact of the confirmed cases. Because the resources we have to also ensure that we efficiently manage our resources. So that is what we have to do. But the laboratories are there, the reagents are there in all the states, and the sample collection sites are also available. And then it's just for people to come to do the test. Some people, it may be that they don't know where these sites are. So the states need to do more in terms of announcing where they are located. If you go to website of Nigeria Center for Disease Control, they publish where we have these laboratories and where we may be able to collect these samples for many of the states. So I think what we need to do is to continue to talk, and just like the media too, they are critical stakeholders in these regards in terms of awareness creation. We also use the avenue of community engagement platforms that we have to use the existing structure, National Orientation Agency, the National Primary Care Development Agency, working with the State Primary Care Board and the local government to ensure that they create awareness. And then when there are other programs, on campaign or whatever public health programs they are doing in the community, this opportunity to also remind people that people who show symptoms should go out there to do the test. This is important now when we are having spikes in other countries, because as we are entering this season, and then our borders in terms of international travel have opened. And then it means that the risk of the cases coming into the country is still there. Even though Nigeria has put measures in place to ensure that those who come into the country are properly screened, and then at least they show negative result that 96 hours before they board. And when they come to Nigeria, and they are also expected to stay for 7 days at home, and then also do the second test, which they will have paid for before they leave the country of departure. And this actually seems to be working. And then, so that's at least, I mean, to limit the chances of these cases coming into the country. Even those people are also follow up to monitor them, to remind them of what they need to do.
Mr. Disi, you mentioned something here about the testing centers and areas where they can collect the samples spread across the country. Well, you said something. People just need to come. What is stopping the people from coming? This is not the first time that we heard the NCDC talk about people coming to the centers. Not enough people are willing to come to the centers for the testing or to collect for sample collection. Why are people not responding?
Actually, a few months back, we conducted a perception survey and then to understand the perception of threat and efficacy. And then the perception was low as at June, July, when we conducted this. And that was when we were almost at the peak of this transmission in the country. And then what really happened is probably fatigue. People kept hearing about this. And then the reality, the way they perceive the reality, the severity of this disease is not as what they expected in the beginning. And then the reason for that is because of our population. We have youth population, and the majority of the people that have it shows that the age is between 31 and 40 years. And then we still have other younger age groups that have this disease. But many of them have the symptoms. They are very mild, but you see some who progress to severity and death. And these include people who are above 50 years, and then people who have other conditions, comorbidities. And then compared to Western world, and then this proportion of people are very few. And that is the reason, and then the people now feel that, oh, after all, this thing cannot really affect us. Maybe what we have is malaria. And the confusion between malaria and COVID-19 is COVID-19 shows the same symptoms with malaria. And then the only way you can know this is COVID-19 is by going for testing, especially where you know you are from a place where you have high transmission or where you have been in contact with a confirmed case. And then that means that you should suspect that this could be COVID-19. And so the major issue here is we just need to continue to talk to people to know that the risk is there, even though if they are young, they think they are not vulnerable, but they have their loved ones who are elderly, people who may be having hypertension, diabetes, who are closer to them, who when they get this, may have significant impact on them. Then some of them have lost their lives in this regard. So we need to continue to remind them because they have one or two things to do with them to benefit from them. And then sometimes they are also caregivers of these people. They are our parents, they are our uncles, they are our brothers. Sometimes they are our teachers and they are our pastors, wherever we go. So we just need to create that risk perception, that implication of us not complying with the protocols. And it's not just the testing people are not doing. You can see they don't wear face masks anymore. People don't even care to wash their hands. And it's still pointing out to the fact that the perception of risk is low. But we won't stop. We need to continue to engage people. And the strategy that we think we need to do, which is what we're already doing, is community engagement. And then to use a bottom-up approach to let people themselves review their life and be stakeholders in decision-making, understand how this disease is transmitted in their own context, and what can they do with the local resources that they have, and local technology, and then local ideas, and see how they can come up with an idea of how to prevent this. It is only community that can end epidemic or pandemic. It is not government. Government can only provide direction, resources, policy, strategy, but it is the people themselves. But with the way we are going, if we refuse to obey the protocols, as long as we are having transmission around the world, and it's a global village, people come in and go out of Nigeria, then the risk of it coming in is still there. And we are not saying that people, even after people have done their second test, they are coming with negative results. We still have very few of them. Within 7 days, we still turn out positive, although they are very few. And then this way, we learn from our experience before the lockdown, when we just allow people, when they come into the country, without testing them, though we don't even have enough resources to do testing then. And these same people keep going around. That's where we have community transmission we have today. And then now we have learned from that by ensuring that they do the test before they come in. When they come in again, they do their test day 7. That way, the contribution of that to the existing burden is very minimal. And we can quickly follow up with them and make sure that they get the appropriate care so that they don't show any severity or cause further transmission in the community.
Right,
so
Mr.
the
Disu,
idea is we continue to remind
Disu,
people.
I beg your pardon. I beg your pardon. You spoke earlier about the arrival protocols. What about the protocol for those who want to leave the country, those who want to travel?
As their strategies. Now, Nigeria's strategy, learning from our experience, PTF decided that we don't want to repeat what happened in March. And that was why PTF decided that they need to test people who are coming into the country. Now, when people are going out, the country you are going to determines their own criteria. And they are the ones that will tell you whether they want people to do tests or not. And then we cannot just be testing everybody that is going out. You know how many Nigerians that travel out to different countries of the world? When you get to that country, they have their own protocols. So we didn't mandate people who are traveling out to do tests. Those who go to do it, they just do it for their own sake in case they get to the country and the country is requesting for the test results. It's just like yellow fever card. And there are some countries that require you to have yellow fever cards when you are coming to their country, like South Africa. Then there are countries like United States that don't require you to bring in, show your yellow fever card when you are coming in, to show evidence that you are vaccinated with yellow fever. So different countries have their own protocols. Nigeria does not focus on people who are living in Nigeria because that does not give us any risk. But over time, we continue to review these protocols. When they get to that level where they feel they need to test people that need to go out, then they will take that decision if data or evidence suggests that.
Okay.
Prof. Go ahead.
Prof. Abimiku, this matter of testing and all of that brings to mind the question of data collection and data management. While we're still looking at how to get data from the rural communities, the border communities, put it all together, one begins to think about also system thinking. Are the citizens, especially when it comes to going to get tested, health issues, has the thinking in society generally been elevated to the point where you can say there's system thinking and everybody's concerned about gathering this data and ensuring that that data is accurate?
Yeah, so before I go into the data part, I do need to mention that as far as I know, just to be clear, the testing that still happens in Nigeria is symptomatic testing. So when you ask the questions, we have the centers to collect the specimens and get tested. Why are people not going? It's because based on what NCDC has put out there and the facility that is, the resources that is available, they're still focusing on symptomatic testing and contact tracing. So it's not as if I have a cold today and I'm suspecting I could go, or for the heck of it, somebody is around and I want to go and get tested, I can get tested. It's still really limited. And like my colleague from NCDC said, it's a targeted testing. So that really needs to be clear. I think if you open it up to everyone, you will find a lot of people going and probably overcrowded. But to your question about setting up the systems, especially that will collect accurate data that the country can continue to depend on, and even during this pandemic, be able to see the trajectory of the spread. It's a really important issue, and I am sure that my colleague from NCDC would have more to add into that. But one thing that NCDC has done, and the government of Nigeria has done more systematically, is that they've worked with the US government. Really, the CDC and the USAID are the key partners that I know of to build a system that collects reliable data that is not just targeting one disease. So that's something that the leadership, the health leadership in the country wanted to emphasize, that if we have a data system that is set up in the country, it should be available for whatever disease we really do want to monitor. So for instance, if you go to the NCDC website today, you get data on all parts of the country. And it's because they've really taken the time to put out the systems that collect data and have and work with the states to also have like data entry clerks, statisticians, and individuals that really clean up your data so that what comes back to the central point is a data that is reliable, but that also can be segregated to the state, to the local government. I think that one of the things that Nigeria did and surprised the rest of the world globally in 2018 is the population-based AIDS impact study. So as you know, we've been talking about HIV. We've been saying that the seroprevalence in the country is about 5%, it's about 10%. And nobody really knew because we were working with what we call convenient sampling. So samples that come in from the hospital, from ANC clinic, periodically we tested across the country to find out the prevalence of HIV. But what Nigeria did in 2018 with funding from the US government is to go to selected houses. So just like you do your census, and test individuals within that household. So it's unbiased, it's across the country, and it gave us a good picture of the prevalence of HIV that we have in the country. And in fact, we came out, Nigeria came out with the figures that is much less than has been presented. But more importantly, it was also able to show what we call hotspots. So you could see the different clusters within the country where we still have to put in significantly more effort to try and end the HIV epidemic. Now, all of that systems that have been put together to collect that data from different parts of the country is available, and in fact, NCDC is using it to whether to look at Lassa, whether to look at yellow fever, whether to address COVID. So, you know, to address your question about system, I think that's the direction Nigeria is going, that they establish one reliable, robust system that will be able to act as a surveillance for the various diseases for the country, and even non-communicable diseases as well. So that data system is absolutely critical for the country to know where it is at any point in time.
Now, Prof, staying with you, there seems to be a race to find a vaccine for this virus. I mean, I think it was last week or something, Russia was putting out something, and America is setting some deadline for when theirs should be ready. You know, everybody is racing to find some kind of cure for this thing. Where do we stand in this race?
Well, we as a nation have always participated, certainly in some of the discussions that are going on. I know for a fact our Minister of Health has signed on with the solidarity vaccine effort that is being led by WHO, that Nigeria and its institution would be part and parcel of any effort towards finding an effective and reliable vaccine. The Institute of Human Virology, where I work, is a partner in this effort, and because what we have within the country is what we call clinical trial unit, where you are able
to go on a quick break, Prof. If you don't mind, please, we'll take a quick break. We'll come back and you pick it up from that point. Please, just stay with us. Thank you for staying with us. Professor Abimike, we're talking about the question I asked before we went on that break had to do with the vaccine, and she wanted to know what's Nigeria's position at this point in time, at what our status as regards the vaccine.
And I was just saying that Nigeria has actually signed on in terms of contributing to finding an effective vaccine through the solidarity vaccine effort. And that might mean a number of things. It might mean that you are contributing to some of the discussions in designing the vaccine. You are contributing to the testing of the vaccines. You are contributing to the analysis of the vaccine. Now it's a global village, like my colleague said, and it's not necessary for you to start from the laboratory to the field to show that you are part and parcel of this global challenge. So I know that Nigeria is participating, and I was sharing the fact that the Institute of Human Virology is part of the site that would be testing any vaccine that comes into the country, because we have the clinical trial unit, which allows the unbiased testing. NAFDAC is part of that, NIMA is also part of that, and a number of institutions within the country. So there's no doubt that we are at the table and we are contributing as well. As far as the status, you know, I think there are two versions. There's the political versions where people are taking the goalpost of having an effective vaccine to coincide with their political gains. And we see that in the US government, and we see that in Russia and China, for instance. And whether it's this race, but it's linked with politics. That's not what we need for an effective vaccine. What we need for an effective vaccine is what the scientists are telling us, in which case right now there are a number of vaccines, probably 3 are the front runners. by Moderna and BioNTech and Imperial College in London. The other two are in the US and Germany, that are really at the forefront. They are in the phase of the phase 3 testing. And a number of these individuals have the intention of testing about 25 to 30 people. By mid of next year, we probably will have an indication of an effective vaccine. But Nigeria is certainly on the table and contributing to some of the knowledge. Some of the knowledge also comes in looking at the immune response that people are infected mounting and whether that is protecting other individuals. Nigeria is already part, and certainly our institute is part of the global effort towards that, and we're contributing results. So I think we are right in the midst of it, and when we get an effective vaccine, we're certain that it's good for our population as well.
Adding to that, I think we should also be looking at the demand side. So by the time the vaccine gets to Nigeria, are people going to accept it? Who should be the target? Because we still don't know what quantity will come in. Should we prioritize the vulnerables? And those are the conversations we should be having now. And considering the experience we've had about vaccination in the past, this is time to start engaging stakeholders when it comes to vaccine acceptability, hesitancy, to see how to leverage on the existing structures. We already have an institution, National Primary Care Development Agency, who is in charge of that in Nigeria, and then they work with polio structures, whether in the north or in the south, bringing religious leaders together. These are stakeholders that have roles to play in terms of how people are going to accept this vaccine. Because we are not immune to the misinformation and the controversy that is going around the vaccination. So the earlier we start having these conversations, so Nigerians will be properly educated so that they can take informed decisions when it is time to take these vaccines. I think that effort is also, the planning for that is also ongoing in the country.
It's a good thing that you stepped in, Mr. DC, to talk about this planning, citizen engagement. You remember there was a time there was a vaccine that was being tested in some parts of the country, and at the end of the day, there was a court case that went on for quite a while. Some lives were lost in that kind of situation. That led to some level of apathy where people, whenever they hear vaccine, some parents will say, no, I don't want to see you, I don't want to hear anything, don't touch my child. And indeed, I had a situation where the school authorities had to call me to say, we want to give your child this vaccine, is it okay with you? I had to say, hold on, what's the name of the vaccine? I went ahead to do my own checks before I said, okay, go ahead and do that. How much of that engagement is really, not on paper, really going on?
We already have a structure we use for polio eradication, which is our traditional institutions, religious institutions. It's all about trust, and it's all about the facts science is bringing out. So once science has concluded their own, and they have said this is, because for the trials, there are things they look at. They look at efficacy and they look at safety. And once it's within the safety margin that is acceptable, and then we already know the limitations, and then people who are likely to develop complications to get this vaccine. Those are the things the trials will tell us, so that to exclude those people from getting the vaccine. And I know that by the time science tells us that it is safe, it is really safe. But the issue about interpretation of science findings is what really matters now, because you cannot rule out the experience of the people when it comes to interpretation of science reports. But conversation, understanding, engagement is what we really need. And we need to be transparent about this for people to buy into this. Our religious leaders, they have roles to play. The media have roles to play, because how the media also shape the stories, and then how they are able to ensure that this conversation goes in a way that everybody has make contribution to this. They share their experience. Once it is transparent and everybody buys into this, and I'm sure that the degree of acceptability or acceptance is going to rise. And once some people start taking it, they see the effect, that you will see other people that will say, oh, yes, after all, it's not bad, and let them take this vaccine. There will be always one issue or the other, but once we have the committee in place to also address such concerns as they arise, and then we'll be able to win the battle.
But Professor Abimiku, I'll still take you back to that matter of citizen engagement beyond the vaccines. Earlier, we talked about the number of people wearing the face mask, how people are no longer washing their hands as they used to. Indeed, the number of people going into shops to buy the hand sanitizers or even making them has also dropped. Now, if we have that kind of thing where the participation in the protocols, safety protocols appear to be dropping, what's the guarantee that participation in the vaccine when it comes in would even rise?
No, absolutely. That's a very key issue, and my colleague over here has really hammered on the importance of engagement. And your question is also very key, because we don't wait to engage when we have the vaccine. The engagement should be happening now. And the second thing is that we've got to remember that we've got real experience in Nigeria on dealing with difficulties of vaccines. You mentioned the Pfizer study that had to be closed down because things were not done right. There's a lot Nigeria learned from that. We talk about the polio eradication and everything that had to be done with the community to really engage and educate them on that. We have all of that wealth of knowledge. You talk about HIV and the experimental vaccines and how NACA was working with the community to just get them to accept all of that. It's all of this experience must come to bear. And we really should be working right now with an expectation of a vaccine by mid next year. But to your point, it's absolutely critical that as we go out and talk about vaccines by nature, you need time to really get going. So it's not the fact that you get a vaccination today, you automatically become protected. So one of the things that we must be teaching our population is that the issue of wearing masks, the issue of hand washing and all of that, we must continue until we get to the point where we've gotten this virus to such minimal level that our immune system can deal with it. So, you know, the issues around wearing masks, the issue around washing, honestly, I know that at a certain time, people get tired, but the alternative is a lockdown, like we're seeing in the Western Wall now. You're not doing all of this washing of hands and wearing of masks. You want to go out, you want to have summer, but what has happened is there's a spike, and now you're going back to lockdown. So we have to continue to teach our folks that wearing masks and washing of hands, even when we have a vaccine, is absolutely critical. And if we would just collectively be responsible for that brief period of time, we will be able to bring this virus to the barest minimum that our immune system can take over. But it's a storyline, it's an engagement that should start now and that should continue even during vaccination.
Mr. Disu, the Nigeria Center for Disease Control, well, there are those who say it has its work cut out for them. The recent protest also affected some of the test and data collection centers. What's the situation like in recouping and getting back on track?
Okay. Our data suggested that in the week 43, that was the last week we just concluded, the testing rates really came down because of the mass protest across the country. And then, but I think it should have improved now by the time that was week 43, week 42 was 2 weeks ago. And then they just this concluded week because when things calm down, and then we hope to see improvement by Monday when they analyze the data and then they bring it out. And then because the states have actually made significant efforts in setting up sample collection sites in the LGAs, bringing it closer to the rural areas, and then making sure that they provide logistics for transportation, and also using reporting system to make sure that we deliver results promptly to people. That has been piloted in Abuja, and then now it's been scaled up to other states. So issue of delay in getting results will soon be a thing of the past. But we are building the ship as we are sailing it. And I think that is where we are with testing. And with things coming down now, protest, then we continue to drive demand creation for testing, and we hope more people will come out and utilize these services that the states are setting up. For those states that have not yet done this, we're encouraging them because they have resources, support for federal government. And then World Bank through NCDC gave them 100 million naira about a month ago towards this. And they've also gotten another 1 billion naira from Presidential Task Force to support the response in the state. And they develop plan towards this. And then the only thing is we want people to leverage on this, take advantage of this, to come out and then do this testing. We need to encourage our neighbors. This is a time for us to all take responsibility at all levels, at individual level, at family level, at community level, at public policy-making level, even public and private sectors, they are all included to ensure that we all do our part so that we can all combat COVID-19 transmission in the country.
Very much, Mr. Yaya Disu, Head Risk Communication Division of the Nigeria Center for Disease Control, as well as Professor Alashle Abimeku, Executive Director, Institute of Virology, both of whom joined us from our studio in Abuja. Thank you very much for coming to bring us up to speed about our status regarding the COVID-19 pandemic. Sunrise will be back very, very shortly with the home stretch. See you in just a bit.